A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
It's an ethical issue.
It's
Supposed to
Oh,
help us.
Medical Dilemma.
Hi, I'm Sonny Del Rosario. Thank you for tuning in to the pilot episode of Medical Dilemma. A dilemma is a situation in which one needs to choose between two alternatives that are equally undesirable. Having to make the choice causes anxiety and even self-doubt, which could be detrimental to one's mental, spiritual, and even physical well-being. The medical field abounds with such situations that often make it difficult for both practitioners and patients to come to satisfactory decisions. In this first episode, we will address the general questions that surround dilemmas in the medical field. Co-hosting the show with me are Father Jerry Manlangit, Professor of Bioethics from the Order of Preachers, also known as the Dominicans. Welcome to the show, Father.
Hello, Sonny. Thank you for having me here.
And we also have Dr. Teresita Sanchez, a specialist in obstetrics and gynecology and a lawyer. Hello, Dr. Sanchez.
Hi, Sunny, and a good day to everyone out there.
And of course, we have attorney Sarah Jane Sugitan, founding partner of Sugitan Law Office.
Hi, Sunny, and hello to everyone who are watching this show.
All right, now let's start the discussion about medical dilemmas in general. Father Jerry, could you discuss briefly the context that surrounds medical dilemmas?
Well, when we talk about medical dilemma, it refers to various procedures in medicine and surgery which can be done as easily as we can now with the help of technology and many other advances in medicine. However, even if the technology is present, there are other concerns and issues that come out of it. Many of them sometimes are legal and ethical. And here is where the issues would come in, and they need resolution.
Okay, well, you mentioned the legal aspect of medical dilemmas. So why don't we hear from Attorney Sugitan about the legal aspect of such topics?
Yes, thank you, Sonny. You know, when we were conceptualizing this show, all four of us, we were thinking of everyday situations that people face. For example, as Doctora said, when we were brainstorming, what if you are diagnosed with cancer? What do you do first? How do you respond? What are the options available to you, and how do you choose? How do you go down a certain direction? And in fact, I'm going to cite a specific example that's very popular lately. There's a young singer who recently died of lung cancer. And his partner or his girlfriend utilized social media to document the deterioration of this young singer. I think I should name them because they're part of the news, Jamich, no? And I'd like to take this case as a talking point for this episode. For example, ang mga bata ngayon, they document everything, they broadcast everything on their Facebook, on their Twitter, on their Instagram. But you know, in other jurisdictions, bawal nga may bantay sa ospital eh. Because when you're sick or when you're dying, you know, do you want guests to see you the way when you're being treated, etc.? So there is a dilemma there. Should you, for me, the dilemma there is, aren't we invading the right to privacy
So
of
you mean
the patient?
broadcasting the condition of a patient?
Yes, and on the other hand, he is a public figure.
Okay.
So his right to privacy is eroded. Kumbaga, Michael Jackson or any celebrity, if you go into any surgery, any treatment, and media hears about it, people have a right to talk about you. But on the other hand, if you were the celebrity, hindi ba ang dilemma mo naman doon, paano ako gagaling? And why can't people respect my right to privacy on that matter? And for me, that's a dilemma. Like for example, it's even an ethical issue for me, Father. Is it correct for the girlfriend, for example, to, she filmed kasi she documented herself crying after they buried the singer, the young singer. And she was documenting herself, she was videoing, taking a selfie, crying. So people don't think that, well, some people side with her and they are one with her in this time of grief. But the others don't like what they see. They feel that you're capitalizing on someone else's death.
It's too personal also.
It's too personal.
Right.
So these are the kinds of things, issues that I think we will be discussing in this show. When we are faced with a certain medical dilemma, how do you decide? Because you will be presented with medical options, and then at the same time, we're a very Catholic, very religious, country. We have to face that, and we are very values-oriented eh. Like, yun nga, sinasabi ko, bantay sa ospital. The underlying value there is the family, the kinship. Hindi pwedeng iwanan na may sakit eh. But at the same time, is that even on the medical side, is that recommended? On the legal side, is that recommended?
And
So
I
if
wonder,
we take the medical side, so how would you
going
view
back
this?
to her, you know, I wonder, was the patient informed? Does he know that he was being taken pictures of?
Yes.
You know, because that's very important, you know.
Yeah, did he consent to that, for
Yes,
example?
yes.
So, Dr. Sanchez, you're referring to the patient's bill of rights. If they're-
Well, in a way, yes. But you
Yes.
know, even in the States and even in other countries, no, it is sometimes wrong to take pictures of a person who is dying. For example, in a vehicular accident, we had Princess Diane before, no?
The Diana,
I think
Princess Diana, yes.
there was, you know, nobody wanted to publish the pictures, even though there were offers, no? Oh, we have shot these pictures, can we buy them? Nobody wanted to, out of respect for the princess. So that's it.
Father Jerry, why do you think there is a big discrepancy between how we, practice our ethics here in the Philippines compared to how it's done in other countries?
Oh, there is a big difference with what they practice and what we practice here. Many times, practice of medicine in the West is more technological, is more professional, actually. They have something about the cultural, but hardly do they speak about the spiritual. Okay? And we know for a fact that medicine is supposed to be a holistic practice, that you cannot just take away yung other aspects in healthcare, because healthcare is not only professional or technical. Okay? But here, in our country, it's a whole plethora of everything that comes into the patient's whole being. Okay? Culture, beliefs, family, affordability, economics, no? And many other things that come into play. And in every aspect, there is always an ethical issue that would come in. And there is where sometimes the controversy will pop up, and we have to address this controversy.
I see. Well, if that is the case, then would there be examples of dilemmas that can actually be resolved completely?
There are, for as long as there are clear policies and clear understanding of a particular case. We talk about, for example, cosmetic surgery. Okay? There are so many procedures in cosmetic surgery, beautifying procedures, and then treatment procedures, and many other things. And sometimes the question, for example, will boil down to, well, is it a necessity? Is it vanity? Or is it insanity?
Insanity.
So all these elements will come in, and we have to resolve those issues. And that is where this medical dilemma would also come in, and it will become very, very relevant to those who are viewing this program, and they will be able to be educated as far as these are concerned.
I'd like to expound on that. Father mentioned cosmetic surgery, which is becoming, I think, more accessible, more popular, even to young adolescents.
That's right.
No?
It's been very pervasive in society now.
Yes, exactly. Like I remember when I started having pimples in high school, my mom would recommend you go to a facial, you have a facial. And it's painful at that time and all these
Right.
things. And it has far-reaching effects. You will have, yung mga peklat, etc. Pero right now, I think yung nga sabi ni Father, is it vanity or insanity? Is it a necessity even? Because maraming, like in the States, well, even here, I think maraming obese eh. Marami ng mga bata malakas kumain, etc. And then they get taunted for that in school. Because we have a certain appearance, dapat maputi ka, payat ka, mahaba buhok mo, black yung hair mo. So, young people are faced with that dilemma, so to speak. If cosmetic surgery is available to them, not necessarily, but let's say liposuction or any beautifying or aesthetic procedures, and their parents consent to it and agree to it, oh, why not? Para so you can help build your self-confidence in school, especially during high school years or early teens. Then, and then they pursue that road. So, on a legal issue, on the legal aspect, well, they can if they both consent to that. But however, yung effects nun eh.
Long-term effects,
Long-term
no?
effects eh. Sa school,
Psychological,
psychological, and then their peers.
Because their companions will know that they had underwent
Yes.
this plastic procedure, di ba?
And would it bring about a trend among their classmates? Baka lahat sila, oh, mami, yung kaklase ko, nagpapayat siya eh. I also want like that. Instant. You know, in one procedure, I'll lose weight instead of losing weight.
This is becoming a trend among the young. As early as 12, 13, 14, they are now going for Botox procedures. All of this.
In order
Such
to
a young
They are.
augment their Botox,
Yes.
you mean? Oh my
Those
gosh.
with
Eye bags.
eye bags.
Oh, yeah. Really.
And now they had entered the population of China. Because you know the Chinese have smaller eyes and they want to have a bigger
They want
one
to have
to
bigger
be more
eyes.
attractive.
Yes.
And this is a multi-billion-dollar industry now. So, but we cannot just take away the ethical aspect.
I see. Okay. Are there scenarios where there are conflicts between, medical practice and the observance of ethics?
Oh, certainly. Let's go to one particular case. Transgender surgery.
Operations, yeah.
In which a man, goes for a transgender surgery, and later on, after some procedure, he becomes a woman, at least in that particular area of the body. So he's a woman with some slit there, and now he says, I'm a woman. Does he
But
become a
legally,
woman?
Yeah.
And so the question is,
Exactly.
what is the essence of a woman? So all those will come in. And then also surrogate motherhood. Okay? Who is the mother of the baby? Okay?
That's where
I
the
see.
legal aspect really will come in.
Legal
So
aspect
going
will
back
come
to
in.
the legal
Yeah.
aspect,
Pero-
what
but-
developments have been, going on to address such issues?
Right. And to answer also Father's question, what is the essence of a woman? So Shmita-sen answered, it's giving birth. No? So the reproductive capacity of the woman is the essence of the woman. Now, on the legal aspect, okay, we had the Jennifer Laude case, and everyone called him, her, transgender woman. And then everybody seemed to take a certain shame, for example, in media, to call him a man or to address Jennifer Laude as him, when naturally, biologically, he's a him. He's a he. Okay?
And legally likewise.
And legally likewise. Now, I am told, legally likewise, he's a he.
Yeah.
Yes. Now,
Birth
what are the
certificate.
implications? So, kasi may implications eh. Iba ang man, ibang woman in our laws. And it's not based on religion or ethics. It's
Right.
based on biology, your body. So, for a man who has been transformed into a woman by having surgery in that specific area, does he necessarily become a woman under the law? I will say no. Okay, not under our jurisdiction, because the way, for example, the way we treat him or address him in the news, everything, is not based on, as I said, religion or ethics or anything morality. It's based on his nature as a man. Now, our laws will take a long time to recognize transgender rights or even
Correct.
pass a law on, ano yung tawag na, father, yung same-sex marriage.
Okay,
It will
well,
take a long
that's
time.
very intensive discussion that we
Right.
have
Very,
here.
very intensive.
Let's pause for a break, and then we'll pick up from that point again.
Many of our products were designed to be used in industrial and medical economy.